Good morning, all of you. Your today's topic is pain, in which we can study introduction, nature, factors, and types. Course name is Nursing Foundation, and their course code is BSCN1003. My name is Pooja Saraswat, faculty of Calcutta's University School of Nursing. You should know these points before started the topic: care of patient, reading expressions of patient, patient's comfort level. Objectives of the lecture is definition, nature of pain, sign and symptoms, types of pain, factor influencing pain, summary and practice questions. So, definition. How can we define the pain? Pain is an unpleasant sensory and emotional experiences associated with actual or potential tissue damage or described in terms of such damages. Next is nature of pain. Pain is subjective and highly individualized. Its stimulus is physical and/or mental in nature. It interferes with personal relationships and influences the meaning of life. Only the patient knows whether pain is present, and how the experience feels may not be directly proportional to amount of tissue injury. Sign and symptoms of pain, that is increased respiratory rate, increased heart rate, peripheral vasoconstrictions, pallor, elevated blood pressure, increased blood glucose level, diaphoresis, dilated pupils, mourning, gouging the area, and restlessness. There are various types of pain. Pain is classified based on duration, based on location, based on intensity, and based on etiology. First is based on duration. Based on duration, pain is classified into two parts, that is acute and chronic is further divided into three parts, that is chronic non-cancer pain, chronic cancer pain, chronic episodic pain. So acute pain, when pain lasts only through the expected recovery period, it is described as acute pain. Acute pain is protective, has an identifiable cause, is of short duration, and has limited tissue damage and emotional response. It eventually resolves with or without treatment after an injured area heals. Complete pain relief is not always achievable, but reducing pain to a tolerable level is realistic. Next is chronic pain. Chronic pain is the pain that lasts longer than 6 months and is constant and recurring with a mild to severe intensity. It does not always have an identifiable cause and leads to great personal suffering. Example: arthritic pain, headache, peripheral neuropathy. Chronic pain may be divided into three parts, that is chronic non-cancer pain, chronic cancer pain, and chronic episodic pain. Based on intensity, pain is divided into three parts, that is mild pain, moderate pain, and severe pain. So mild pain, pain scale reading from 1 to 3 is considered as mild pain. This is pain assessment 2. Moderate pain is pain scale reading from 4 to 6 is considered as moderate pain, and severe pain, pain scale reading from 7 to 10 is considered as severe pain. Based on etiology, classification of pain that is based on etiology is nociceptive pain and neuropathic pain. Nociceptive pain divided into two parts, somatic pain and visceral pain, and neuropathic pain is further divided into two parts, peripheral neuropathic pain and central neuropathic pain. Nociceptive pain is experienced when an intact, properly functioning nervous system sends signal that tissues are damaged, requiring attention and proper care. For example, the pain experienced following a cut or broken bone alerts the person to avoid further damage until it is properly healed. Once stabilized or healed, the pain goes away. In nociceptive pain, somatic pain, this is the pain that is originating from the skin, muscles, bone, or connective tissue. The sharp sensation of a paper cut or aching of a sprained ankle are common examples of somatic pain. Next is visceral pain. Visceral pain is pain that results from the activation of nociceptors of the thoracic, pelvic, or abdominal viscera, characterized by cramping, throbbing, pressing, or aching qualities. Example, labor pain, angina pectoris, or irritable bowel. Next is neuropathic pain. Neuropathic pain is associated with damage or malfunctioning nerves due to illness, injury, or undetermined reasons. Example, diabetic peripheral neuropathy, phantom limb pain, spinal cord injury pain. It is usually chronic. It is described as burning, electric shock, or tingling and aching. Neuropathic pain tends to be difficult to treat. Neuropathic pain further divided into two parts, that is peripheral neuropathic pain and central neuropathic pain. Peripheral neuropathic pain is due to damage to peripheral nervous system, example phantom limb pain, and central neuropathic pain that is results from malfunctioning nerves in the central nervous system, that is example spinal cord injury pain and post stroke pain. Now, factor influencing pain. First factor is developmental factor. In this, age influences pain, particularly in infants and older adults. Young children have trouble understanding pain and the procedures that cause it. If they have not developed full vocabularies, they have difficulty verbally describing and expressing pain to parents or caregivers. With the developmental factors in mind, assessment should be done for pain in children. Second is physiological factor. In this, first is fatigue. Fatigue heightens the perception of pain and decreases coping abilities. If it occurs along with sleeplessness, the perception of pain is even greater. Second is genes. Research on healthy human subjects suggests that genetic information passed on by parents possibly increases or decreases the person's sensitivity to pain and determines pain threshold or pain tolerance. Third is neurological functions. Any factor that interrupts or influences normal pain reception or perception, example spinal cord injury, affects the patient's awareness of and response to pain. Third is social factor. In this, first part is attention. The degree to which a patient focuses attention on pain influences pain perception. Increased attention is associated with increased pain, whereas distraction is associated with a diminished pain response. Second is previous experience. If a person repeatedly experiences the same type of pain that was relieved successfully in the past, the patient finds it easier to interpret the pain sensation. Third is family and social support. The presence of family or friends can often make the pain experience less stressful. Fourth is psychological factor. In this, first is also anxiety. Anxiety often increases the perception of pain and pain causes feeling of anxiety. Second part, critically ill or injured patient who perceive a lack of control over their environment and care have high anxiety levels. This anxiety leads to severe pain. Second part is coping style. Person with better coping levels perceives less a pain than the person with lower coping level. In summarized form, we can say that pain is a signal in your nervous system that something may be wrong. It is an unpleasant feeling such as a prick, tingle, sting, burn, or ache. Pain may be sharp or dull. It may come and go, or it may be constant. You may feel pain in one area of your body, such as your back, abdomen, chest, pelvis, or you may feel pain all over. These are the questions which arise from the lecture, that is, define pain, enlist types of pain, explain factor influencing pain, and define somatic pain. Thank you.